Well, basically, Sleepology has been kind of developed over the last 10 years, because what I realized was that you need to do certain things in a certain order in order for things to work. What I've been finding over the years that I've been working with people, what happens is they come to me and they say, I've tried a bit of this, I've done a melatonin, I've tried a bit of yoga now and then, and nothing is very consistent. And I realized that what you need to do is that you need to calm the nervous system first. Otherwise, nothing is going to work, because the nervous system and the mind overrides everything. You see from nocebos and placebos how powerful the mind is. And unless you can actually get the mind a little bit under control, nothing else is going to work. So the methodology always starts with the mind, once you've actually found out what the root of the issue is, and you've designed a program, and it starts with the mind. And then once the mind is a little bit under control, you can then start looking at the digestive system, because I know from my own personal experience and from clients, when the nervous system is disturbed, the digestion is very often disturbed. So you have this sort of microbiome in the gut, which is all the bugs, and you have happy bugs and not so happy bugs. And when the nervous system is disturbed, all that gets disturbed, and that disturbs the sleep. So what we do is we calm the nervous system, then we look at the digestive system, making sure the digestive fire is efficient, making sure that the whole system is working properly. And often you'll find when people are stressed out, they'll have things like IBS and all sorts of digestive issues. So mind first, then the gut, and then we work what I call is the consciousness and the nourishment, because when people aren't absorbing nutrition, then obviously they're not going to have the energy they need. And from an Ayurvedic perspective, Ayurveda is ancient Indian medicine, it's 5,000 years old. They will tell you that you need energy in order to go to sleep, because many people come to me and they say, I'm so exhausted, why can't I sleep? And there lies the problem. It's the exhaustion and the depletion. So in the last phase, we look at nourishment, adding other nutrition in, making sure that they're getting enough nutrition, but also mental nutrition.
I would say 75% of the case management work is mental health based at the best of times, and obviously current circumstances have not changed that. So yeah, a lot of struggles with personal circumstances, but also in workplace where sort of people have been large numbers of the organisation have been furloughed, but those who haven't been furloughed are having to pick up various other people's jobs. So increased work demands, greater sort of scope of what people are doing, and also increased work hours. So some of our clients are working within the NHS, and obviously some of the frontline workers are doing extraordinary hours at the moment, so it's looking to support them as well.
GPs traditionally have been do virtual consultations. It's a telephone call, and a lot of traditional medicine is traditionally done through the history of the patient, the story they give you, and that often gives about 60 to 70% of the diagnosis. But I think the transition to video is a really good one, because I think it really helps in building patient rapport. And, the eye contact, the ability to have some congruence of non-verbal communication, it can be very powerful. And that ability to kind of connect and see the person that you're speaking to, is quite a powerful sort of modality with which to consult. And I think, as I alluded to earlier, it's become the new norm. So at VDOC, we've been doing virtual consultations for a number of years, and always found them to be very effective, to generate prescriptions, to generate referrals as appropriate to fulfill some specialists.
whether you're admitted to a private hospital with COVID or anything else at the moment, then on the company plans we provide company and individual plans, we provide an NHS cash benefit, which can be up to £4,500 over a period, which is a nice thing to have. Maybe that will help with people sleeping at night. But what's more concerning is looking slightly further ahead of where we're going to be in 6 months' time. And it does actually concern me that the queues for NHS treatment were already pretty large. I mean, at the beginning of the year, there were 4 million patients waiting for treatment, of whom 750,000 had already waited for more than 18 weeks. Now, I have no crystal ball, Andrew, but I would suggest that queue isn't going to be will not have diminished. And it's also significantly worrying to me that I heard on the news last night that there's been a 70% drop in referrals for cancer treatment. So people may be having symptoms, but they're not going to the GP or seeking help, and that is, I think, going to result in a significant, I mean, maybe even a tsunami of demand on the NHS in the next time period.
So another good reason why those of us that are in the fortunate position as businesses or individuals to take out private healthcare might want to think about it, or certainly maintain it at this time.